Hello, my name is Lim Chikon. I would like to present the title of Marketing Strategy and Technologies. The industry that I study is the private healthcare in Malaysia, which is the private healthcare in Malaysia is providing the patient-centric services and advanced medical and also the personalized care for the patients. There are key market drivers, which is looking at the aging population, the medical tourism, and also receiving the high demands from the local and also and international patients. Um, Also looking at the integration of technologies, and nowadays they also give driving the markets for the in private healthcare in Malaysia. And these are the research found that have proven and significantly increase of these demands and also the private health care in Malaysia. One of the private hospital that I would like to recommend, and also it's the Regency Specialty Hospital, which is located in the southern city of Peninsular Malaysia and close to Singapore, giving it's also a very strategical locations. These hospitals have catered up with the capacity of the bed of 218, and these are the area of the services can in the Regency Private Hospital. They have been provided the teleconsult, also giving the offering the center of excellence of specialists and also healthcare professional. Also, they have this inpatient appointment guide on the throughout their online, as well as also the virtual consultants experience. I have identified the key opportunities for Regency, which is they are located, located at the southern region of Malaysia, which is close to Singapore, and as well as Indonesia. And this is how it attract the international patient and also the local patient because it's surrounded by the residential area. And it mainly focus also medical tourism because it's also close to the domestic airport and international airport too in Singapore. And these are the comprehensive specialists in their hospital provided. Regency is also one of the member of the medical tourism in Malaysia. We're looking at the major challenges in it might be faced, which is also looking at the price transparency. Though they have been sharing the price transparency in the on their website, but they might some hidden costs. They might not transparent. That it might trigger some of the complaint for the patient. And throughout this, also the patient experience is also important. And nowadays, looking at the ranking of the hospital located at 5th among the 10 private hospitals in Johor. There are another 4 competitors in the markets that for them to capture the patient's loyalty. And the technology disruption definitely looking at also there might be a data overloaded and also the AI adoption for the technology for them to make sure the operation efficiency and looking at digital information as well, looking at the staff resistance and security, cybersecurity risks as well in the hospital. Looking at complementary marketing strategy, there's a one strategy one looking focusing on the patient-centric digital marketing and personalized communication. It's a digital penetration and health consumer expectation. Nowadays, there's a talent vaccines grow, especially using the platform in Malaysia. There's a name called Dr. Call and Book Dog. Here it's the reference of the sessions placed by Sunway Medical Center, one of the giant private healthcare in Malaysia, have successfully captured the patient's engagement and also achieving the patient satisfactions. Second strategy looking at it's the digital marketing and social media engagement and looking at the brand awareness building and also patients engagement then throughout the social media. And below is a study had proven showing the increase of number of patients in Malaysia throughout the social media. And disruptive technologies and healthcare. One looking through the three technology disruptive in healthcare in Malaysia. There's AI, which is also providing the personal patients engagement, predictive analytics, and also decision-making enhancement. The telemedicine throughout the virtual health assistant on providing the easy assessment and also the strengthening the brand identity. The next will be the wearable health technologies. It's also bidding on the community engagement, promote the preventive health care, and also data-driven insights. I would recommend to focus on this AI technology. One is a power chatbot and also the virtual health assistant. That definitely it could provide 24/7 support, also easy arrangement for the scheduling with the doctors without any hassle to call hospital or queuing up by just providing the symptom checking for by recommending for the specialist based on the symptom they given. And multilingual definitely is one of the part of the important because Malaysia is a multiracial country that easy engage with the patient. The important also about the power AI technology here is doing for follow up with the patients after visiting the doctors and hospital, and also they also provide the feedback to the hospital based on the patient's feedback for the improvement purpose. The rest is more focusing on the list on the patient data and the trend tracking for the hospital. The value of technology, I would say benefits both patients and hospital. And beside the hospital focusing on the patient's engagement data and also the efficiency of the operation, the patient definitely will be benefiting from this, looking at the instant access and also accessibility, and definitely can also design on the healthcare program for the patients that need it. One of the challenges of the AI adoption, one is the data privacy security, the cost implementation, resistant change, of course, for the integration of the existing system to the new technology that need to adapt also by the hospital staff, and regulatory and ethical consent, and finally, it's the digital literacy. In the marketing plan that looking for PMix, which is the product price, price and promotion. The overall, these are the area that I think it could be marketing plan can be implemented from the integration of healthcare platform and to the providing the promotion of the bundle prices to the patients to get also to engage with the patient throughout the social media and so mobile apps, even through the platform, and last on promotion to promote the new advanced technologies in a hospital to the patient. In AI power patients engagement by using the tailored value change, which is also starting from the patient intake to the care delivery and services and discharge. They could do follow up till they have the retentions or loyalty throughout the loyalty program and also the aftercare and support. And have mentioned it by talent value chain framework is emphasized the IT is not a cost and it's supposed to be a value added to the hospital or any organizations, and it being supported by the technology development, human resources management, procurement as well for instruction. Looking at the risk mitigation, looking for error data protections and operation disruption, regulatory, combat ethical considerations, and clinical safety quality. And this is a four area you should focusing on that from the encrypt data, and they should engage the legal team, make sure on the rolling out ISO system design, and they should have run the pilots before they establish or roll out the new technology. Right. And these two citations have been supporting the risk mitigation throughout the study before. I will share three cases. One in the previous study, one is in Thailand. Talk about the secure patients engagement. they managed to mitigate the risk by the description and also to complying to the Thai land and international standards. And second is based in Singapore, which is from the data breach, which is caused a major uh, data breach to 1.5 million patients, and managed also to mitigate the issue. And the last one in Malaysia is a digital transformation, when the KBJ hospital want to roll out the digital health records and patient apps. They have be provide the education and also the training to the patients. And I would like to share on the Sustainable Development Goal, which are four SDG that can show to in this marketing strategy and AI technology for building the trust of awareness and innovations of the social media, to be so creative in the multilingual contents, uh, and also the promote the purpose of services and digital health records. In the AI side, it will be able to provide the data analysis and design the healthcare program to the patients, and through the chatbot, they can make an appointment to the doctors without attend to the hospital, and as well also to optimization of hospital operations. The next conclusion I will highlight on this strategic marketing application, patient strategy planning, and also local residential area international markets. Second, it's on the technology competitive differentiator on AI power engagement platform. Last one, it's the implementation of considerations and data privacy and security. And that's all for my presentation today. Thank you.